everyone, and welcome to the pilot episode of Tell My Story, the podcast where we highlight the often overlooked experiences of all frontline workers brought to you by Impact Without Contact. I'm your host, Halima Ahmed, Public Health Lead of IWC, and today we're here with Carol Liu, who works as a nurse practitioner in a long-term care facility. Welcome, Carol.
Thank you so much, Halima.
So to begin, it would be great if you could introduce yourself and the type of work you do.
My name is Carol. I've been working as a nurse for over 16 years in Canada after I have immigrated here. First, I worked as a registered practitioner nurse, and then I became a registered nurse after I studied in Ryerson University. Then later on, I studied my master's degree and become a nurse practitioner at the job I'm doing right now.
That's amazing. Naturally, being a nurse is a very gratifying and also very difficult career to take. What inspired you to become a nurse practitioner?
I was very satisfied with working as a registered nurse in an acute hospital, and I worked 12 hours day shift and night shift. There was a nurse practitioner on the floor I worked. She was very nice and she treated everyone nicely. She was respected by staffs and all the medical staff, nursing staff too. She gave me some inspiration about this. At that time, I was inspired. I wanted to work like her. Additionally, I was just could not sleep well after working night shift. Those the two factors that encouraged me to study.
So thank you so much. That's amazing. For those who may be unaware, what exactly do you do as a nurse in a long-term care facility?
First of all, I would say as you want to be a nurse practitioner, you must graduate from the master degree in primary care or some acute care nurse practitioner programs. And you must pass your exam to be licensed. Most importantly, I would say you need to continue study because of every day you may have different cases. Then in long-term care facility, the population is different. Most of them cannot tell you what they have pain or they have some symptoms. We have to observe the body and look at their face, their grimace or their moaning. Because there are issues with their language, some demented, some have a psych issue. So the main issue for them are different too. And I do assessment, diagnose the resident with their conditions, do other some investigation, and then prescribe treatment for them. I would say the most common infection in long-term care are pneumonia and the urinary tract infection. Those geriatric residents presented very differently from the typical population.
Thank you so much. That's amazing insight for those who may not know. So I guess, what does your typical day as a nurse look like in a long-term care facility?
As my role, I go to the resident with different issues. Some just report to me as a poor oral intake, like food intake, fluid intake. I do full assessment and from breathing and their lungs and abdominal. You have to think about constipation and also urinary tract infection. Those are common one. You have to do assessment and look at their chart, review their last bowel movement and how their urine, avoiding present any smell in their urine. And then I do assessment. Also, I have to collaborate with my staff to get more information about the resident because they work in front line. They are more familiar with the resident that they have there. And then I also talk with the PSW, also the unit nurse there too, to get the whole picture.
Okay, that's really, really amazing insight and definitely very, very important work that you're doing. So I guess segueing in now to the current events, COVID-19 has proven to be a very, very changing time in society. And so I wanted to kind of ask you, before COVID-19 and now, how has your role changed as a nurse? Have you been able to have to do different practices, have a different mindset? Like how has your, I guess, job changed before the pandemic and now?
My job, the main change is currently whenever you go to see a resident, you have to have your mask on and goggles on, try to avoid pass on to the resident in case you have the COVID. And also the resident, in case they have it, you have to protect yourself. Other assessment I consider are the same. You have to do the full the assessment and for the resident, whatever issue they have. And then from there, you do give them some prescription for treatment.
So, considering that many of the COVID-19 hotspots in Canada have occurred within, I guess, care facilities that you kind of work in, like that kind of long term care facilities, have you ever felt concerned about your own health?
Yes, before COVID-19, I work in the clinics and the walk-in clinic and the family doctor clinic. And at that time, we didn't have a much. COVID-19 was okay. They come, we see them. But because of COVID-19, the clinic is kind of shutting down. And then that's the reason I found a full-time job in the long-term care facility. At the same time, the long-term care facility, they do need more nurse practitioner at this pandemic period because many residents try to treat at the long-term care facility to avoid transfer to the emergency. I do feel basically right now we are trying to prevent transferring and talk to the family, treat in the facility. If really necessary, then we have to send to the hospital. Yeah.
So, do you feel like within many long term care facilities, we need more nurse practitioners and other employees there?
Nurse practitioner, they do lead, but usually I would say just one or two because of our practice scope is different from the registered practice nurse and registered nurses. Yeah, I see some like the new hiring on the website. Also, long-term care facilities, they start to hire more because we are working at the front line there, like as a full-time to help the residents rather than the doctor just come do around a few hours, then they leave.
Mhm. I guess throughout the media, it's often discussed how challenging it is for seniors and elderly to kind of keep isolated in their rooms to protect them from COVID-19, right? So, how has it been for the seniors living in your facility?
We do have a policy to isolate whoever go out for appointment or for ER transfer or any discharge, have to isolate it for them for 14 days. Also at the same time, check the COVID status. If it's like over 14 days, also they're negative, and then we can release them after that. They do really feel emotionally isolated because they are only in their room. It's like the really small room. They have a bedroom there, and even though we the staff visit them, send the food to them, and also do the care for them, talk to them, but those are they cannot see the facility inside. They cannot walk around. They do feel really emotionally isolated, physically isolated. And we do give emotional support, but really not enough for them. Also, during the COVID-19 period, families cannot visit seniors
Mhm.
right now. I would say almost all of them, I feel emotionally, physically isolated, even though some present as they can talk about, some mentally are competent, they talk about it. But most of them with dementia, they cannot talk about. They show up as different symptoms like the poor oral intake, and they're just agitated. Our staff face a lot of challenge. We give emotional support and we try to give the FaceTime. See, they have a poor oral intake. We offer the FaceTime when they are having food, lunchtime or supper time, so they know all their family, loved ones still concern them, and then they becoming a little bit happy, and also their appetite increase. We try use different ways to help them. As I mentioned earlier, physical and emotionally, really challenging for the seniors, also for the families too. I feel really sorry about that. And the policy are there, and in order to protect all the seniors, try to let the family understand this issue, and the seniors who are competent understand this issue.
That absolutely. Have you had any specific experiences with a particular senior who may be really, really missing their family, or maybe even family members who really want to see their loved ones? Have you had any, I guess, particular experiences with that?
We do have this one. Also, I saw quite a few in the nursing home. I worked there too. That's we've been getting like a different input from the staff. That's one of them, like a FaceTime. Give a FaceTime when they have a meals. That's one of the measures we are implementing for some person who have a poor oral intake. Also, the different FaceTime, we try to arrange the family with the seniors there to have talking about it. Right now, start to have a visitation. We arrange seniors to the family visit them indoor and outdoor for limited time, 1 hour or 2 hour or half an hour like that.
As a nurse, has it been challenging for you to see some of your patients, I guess, be so like upset away from their family?
Yes, really challenging. We what can we do is just we feel sorry about the current pandemic period, and we wanted to support family, wanted to support our resident too. And we always encourage the family, if you want, we just let you to have a FaceTime. And then the right now, because of the current visitation policy, we encourage family to visit, but no hugging each other, to still cover their face. Also, it's challenging for the seniors because of their face covered half, almost two-thirds, and some seniors with dementia, they cannot hear well, they cannot recognize even the loved ones, and mentally really challenging for them.
With the patients with dementia, how do you try and, I guess, interact with them and make them feel like happy and things like that?
There are many measures to try to interact with those seniors, try to be gentle, talking with them, approach them slowly. And even though you want to touch them, still like the see if they allow you to touch it. Those are a few measures, and for the communication clothes you will use, except those general ways, you give food, you give medication, you have to use really gentle touch, gentle ways to deal with them, because for them it's not really to understand what you are talking with face mask on. Also really for them to process what's going on outside, it's challenging too.
hmm As a nurse, it must be very hard, I guess, for you during the pandemic to have to, I guess, deal with this kind of emotional conflict with your seniors. Have you had any specific challenges yourself during the pandemic as a nurse?
For myself, I feel like especially for me, I feel the most difficult one is communication. You put a mask on, you put a goggle on, or sometimes you put a face shield on, and you try to speak slowly, clearly, but for them, I feel like it's really challenging to talk, to let them understand me well. Or sometimes I have to speak really slowly and to let them understand me. Maybe my accent, maybe the mask on, the sound may be muffled.
hmm
The most challenge for me is just the communication.
Yeah, absolutely. With seniors, it's obviously so important to have communication, and then with all like the masks and the gear and everything, I can't believe how difficult it must have been for you. I guess just to kind of get on a more positive note, have you had or experienced anything positive throughout the pandemic as a nurse? Kind of like a silver lining?
I would say give me a chance to know them better, give them more emotional support. everyone needs those emotional support during those periods. We are as a frontliner, we have those opportunity to help them. So that's we try to help. Even though I feel challenged, I still try to talk, whether use different word, different way to talk, use my arms, hands to let them understand me. And that's one of the aspect. Another aspect I feel every time I talk with them, some residents really need emotional support. I ask them if they want me to pray for them. Some residents are Christian and they like to pray, and I do not hesitate to help pray them with together to let them emotionally supported.
That's absolutely so beautiful. The type
Thank
of
you.
work that you do as a frontline worker, it's amazing. And I really hope that all frontline workers, especially nurses like you who may not get the attention that you guys deserve, I guess really get that appreciation. I think lastly, many people after hearing your story may want to support you or nurses like you. How could we do this?
I felt the most important is support us with the PPE.
Mhm,
And currently we are having 2 masks in one shift.
mhm.
Every time we wear the masks, but maybe after lunch we have to switch a new one. And I'm not sure how long the pandemic will last, but definitely the PPE is a really big issue for the frontliner because we need those PPE to protect us to work safely.
I guess just to finish off, we would like to thank you so much for taking out your time to speak with us. And it was so amazing being able to hear your story. So that's it for our pilot episode with nurse practitioner Carol. Don't forget to tune in next week to hear about another amazing frontline worker. Thank you so much.
Thank you so much, Halima.